Today we're just going to discuss how to don and doff our PPE that we're going to be using for the next couple of months on most of our calls. So just remember that we're going to be going to all of our patients in an N95 mask until we determine that they need more or less personal protective equipment. So we're going to be going up to them with our mask on and our gloves already, while staying 6 feet away. We're going to assess to see if we need to put on our gown and mask, and if that does go true, I'll show you how to put everything off. But the most important thing to limit the exposure to us is actually taking it off, because that's when we're at risk for contaminating ourselves. So we'll be like this when we first approach our patients. When you have your N95 mask on, make sure you're pressing down on your nose to make sure you get a decent seal. We're just protecting ourselves, and we want to make sure everybody else is protected. When you establish that you are going to need to put on your gown and your mask, make sure you come back and really pre-plan long term. Take off everything that you can. Take off your radio strap, take off your radio, take off your job shirt, and anything else extra that you don't need. A lot of the guys wear glasses, sunglasses, stuff like that. Take them off, because that's one less thing you're going to possibly contaminate and have to clean later on. In the back of the ambulance, remember to make sure we close our PPE bags whenever we don't need in there. Close them bags and put them up front or put them away. All the other non-essential bags, like if your trauma bag was out and you figured out you don't need it, put that away, because that's less stuff you have to decontaminate. Anything in the back of the ambulance that you're not going to need, put it away so we can just keep it safe. All right, once we've established that we need everything on, we already have a set of gloves on, we already have a mask on, correct? So we're going to come back here, we're going to put on our gown. We're sending one person in. We're sending all of our providers to the call, but one person's going to assess if this needs to be done, staying 6 feet away from their patient. So you're going to put this on just like a schmop. Unless you're dispatched for a PUI and you know they're already having symptoms, you might as well already gown up, because we're going to need it anyway. If they test positive, if they answer yes to 2 out of the 4 questions on do they have a fever, do they have a cough, do they have shortness of breath, have they been out of the country in the past 21 days, or any sore throat symptoms, then if they answer 2 yeses to that, then you're automatically going to put this stuff on. And everybody knows every one of our flu symptoms patients is going to say yes to that. So we're going to do this for our flu patients and our COVID-19 patients. So you have that on. You place your gown on. You're going to tie it around the neck and then around the back. You're going to put your full face shield on. If these become not available later on, safety glasses are okay by the CDC, but they got to make sure they wrap all the way around. This face shield is what is recommended. Face shield goes on, and to help you out, it's not completely recommended, but this will help you out in the long run, is to double glove. It'll help you when we start taking stuff off. Make sure your wrist is down far enough that top glove is surrounding the top of that gown. All right, you don't want to risk any skin exposure or anything like that. Some of our gowns do have a thumb hole in it, just like our fire jackets, and that helps. But you want to grab that for the part in your palm. And make sure you see how that's creeping up. That's secured. All right, so this is what we're going to be looking like when we approach a lot of our patients in the upcoming months. So now we've done our assessments. We've already gotten our patients back out into the ambulance. We've treated our patients. We've transported our patients. Don't forget, with all the excitement of doing everything, we still need to treat our patients. If they're having signs and symptoms of respiratory issues, if they're sat below 94%, make sure you put oxygen on and all that good stuff. Make sure you alert the hospital and let them know we're coming in. They need to know this regardless. If they test positive for a PUI patient, they've got to know so they can pre-plan, and pre-plan early. All right, AGH has got limited amount of negative pressure rooms, so they've got to move some patients around to make sure they know where to put this patient. So the biggest deal for us as EMS providers is taking this stuff off in a way that doesn't contaminate us. This is our biggest risk out of this whole thing. Is not even the equipment, is contaminating ourselves when we're taking it off. All right, so this is, when you're in a patient's room, once you transfer that patient, right then and there, this stuff gets stripped off. We do not risk walking back through the hospital with contaminated clothing on to contaminate everybody else. So when you're leaving that room, some rooms have negative pressure rooms where you actually disrobe. IGH does not have that. So we're going to be disrobing right at the entrance to the doorway and disposing of this in their proper bags. Don't risk walking through the hospital. So as soon as you disrobe this, wash your hands. You're going to wash your hands 50 times for this whole process. All right, so how to disrobe? All right. So to disrobe this, take everything off. You're going to come through here and you're going to rip this. You're going to rip this neck. All right. This is going to come down. You're going to come down and I'm still here. So now I've got 2 sets of glove off. Remember that second set of glove? This is where it's going to help you. You're going to come through here. You're going to take that first set of gloves off. You're turning this inside out. You're turning the whole robe inside out because this is the stuff that's protected you. This is still the clean side of this robe. Whole robe out. That's off. I still have a set of gloves on. That's off. All right. And then this, from the clean side out, gets disposed of. This is going away. All right. That's going to be thrown away. These are my clean set of gloves on. To get this face shield off, you're going to come around behind the back of your head and then pull it off that way. You're not just going to grab the front of it. It's the same way with our N95s, because these N95s are going to be disposed of because we've been exposed to a PUI patient. If we're not exposed to a PUI patient, these N95s will be reused. But to come around back, you're going to come around back behind that. You're going to be going forward. You're not grabbing the front of the mask. That's going to be disposed of. You're going to walk out of the room, take these gloves off, wash your hands. You're actually going to mask back up and go disinfect your unit. Before you disinfect your unit, while you're taking that patient out, make sure both doors are open and back so you can get that circulation of air. The CDC wants 20 minutes of air circulation before you even go back in to start decontaminating. That's fine and dandy. We might not have that whole complete 20 minutes that we are before we get back, available to us before we get back, need to come back into the city. So keep those doors open while we're transferring that patient. Get your cot cleaned back up, disinfected, and then start going in to disinfect your ambulance. Your driver should not have anything to do with you. This is the one time your driver should be sitting 6 feet away behind you and not helping you out with this. It's the people that have been exposed. When you get back to the station, if you have a gown on, the CDC states that we do not need to take a shower or change clothes or anything like that. You've got to use common sense. If you were kneeling in the patient's bedroom, if you were rubbing if your pants got exposed to all of them, you're going to have to take your pants off and clean them when you get back. All right, so use common sense. If you didn't have to, if that patient could walk, you didn't really touch that patient, you're good to go. You take your gown off and you're good. But this is why we really need to bring multiple sets of uniforms to work for the next couple months. After we've decontaminated the back of our ambulance, we are coming back into the city. Our reports are done. We're still getting our signatures. We can wipe the computer down. That's disinfecting that. That's one of the good parts about our tough books is we can clean them. All right. Instead of taking your pen out and getting them to sign a piece of paper, don't use any of your personal stuff. Let them use stuff that we can clean. After you get back into the city and you get set up, we need to be contacting our supervisor, which they should already know that we had a PUI patient anyway. We need to fill out 2 forms of paper. We need to fill out our first report of injury and our exposure forms. One's for the city, one's for the department. We need to fill out both of them. They're very similar forms, but we do need to get them both filled out. This is very important to keep us safe and out of quarantine. So if you have any questions, please contact us. Stay safe and be healthy.